Hi, everyone. Welcome back. My name is Kara. I'm here with the People's Harm Reduction Alliance and with the Harm Reduction Doula Collective. I'm a co-founder of the Harm Reduction Doula Collective. And today I'm going to talk a little bit about NICU care for babies that are housed and cared for in the NICU and NICU families. And in particular, I want to speak about how the experience of being in the NICU in particular can affect families differently who are experiencing substance use, who are reliant on income from the sex trade, and may or may not be experiencing houselessness or housing instability. Firstly, let's define what a NICU is. NICU stands for Neonatal Intensive Care Unit. Sometimes you may hear acronyms that are similar, like PICU. A PICU is a Pediatric Intensive Care Unit. And the main difference is just the age of the child that is cared for in that hospital setting. NICUs only care for babies that are under the age of 6 months, whereas PICUs care for children over the age of 6 months. And there are different kinds of NICUs and different levels of NICUs housed in different hospitals. So while one hospital may have a NICU and another hospital may have a NICU, the level of care that they are able to provide an infant may be different. So why is this important? It's important to understand based on what kind of care your baby may need, whether or not that hospital is going to be able to support your child's care. Sometimes only hospitals are available in your area for birthing that have lower level NICUs. And sometimes, especially in larger cities, there's hospitals that have a wide range of NICUs, so babies can be transferred in between. I'm going to talk a little bit about the levels really quick. So NICUs range from a level of level 1 to level 4. A level 1 is a standard labor and delivery care unit. So pretty much every hospital that has a birthing unit has a level 1 NICU. A level 2 is slightly more intensive, can care for preemie babies, but not preemie babies that are extremely sick or have more complicated medical needs. A level 3 is a comprehensive care NICU. So the care there is for babies that have some more serious health concerns that can require oftentimes more specialized care, more supervision, more hands on deck. And then a level 4 is the highest level of NICU. And a level 4 is extremely specialized care and also has neonatal surgeons. We're going to get a little bit more into in another video, like who you can expect to be in the NICU. But first, I want to talk about why babies can end up in the NICU. So most commonly when working with families that experience substance use during pregnancy, babies oftentimes can end up in the NICU very early on after labor and delivery because the provider is unsure or nervous about potentially a lack of prenatal care. The idea that there's just an unknown medical history. Sometimes they will move babies to NICU temporarily just to make sure that they're keeping their oxygen levels up, that they're breathing on their own, that they're adapting to being outside the womb, and there's been no complications. That being said, I'm really glad that you all are here, and I'm hoping that by taking this course, by connecting to support, you're able to feel more confident in accessing care. And it's also not to say that just because somebody doesn't have an extensive prenatal care history prior to labor and delivery, that their babies are born unhealthy. It is usually just a precautionary measure. There's a large association between babies that are born to parents who use substances and providers looking for signs of NOWS and NAS, which stands for neonatal opioid withdrawal syndrome or neonatal abstinence syndrome. I'm just going to say it again because those are big acronyms. NOWS is neonatal opioid withdrawal syndrome, and NAS is neonatal abstinence syndrome. So, for instance, when you have your child and you're caring for them, not every hospital is going to have a 5-day compassion stay. Some of them do. Not all the time are you going to be held in the hospital with your baby. Sometimes you are, but the providers are going to be looking for symptoms of NOWS and NAS. And that is like shaking, sneezing, an unconsolable baby. So oftentimes these symptoms are just common for babies anyway, because coming into the world is hard. Adapting to being outside of your birth parents' body is hard, and hospitals can feel pretty stressful, even for adults. So sometimes babies go to the NICU because providers want to make sure that they are not experiencing withdrawal symptoms that are potentially harmful to the baby or to their development. What we know is that most substances that people use, heroin, meth, fentanyl, do not have long-term impacts on child development. So the withdrawal symptoms that your baby might be experiencing are usually temporary, but sometimes in severe cases, or if symptoms are presenting that are causing the baby a lot of distress, sometimes they might move to place baby in the NICU in order to start morphine maintenance. I am going to talk about in the video, if you haven't watched it already, infant feeding and lactation and postpartum care, newborn care. We'll talk a lot about skin-to-skin contact. We'll talk a lot about parent-baby bonding. We'll talk a lot about whether or not you might chest feed or combination feed. And what we know is that one of the best things that we can do to prevent babies from entering the NICU is to feed our babies, whether that is chest feeding. Chest feeding is usually the recommended, but it's, you know, a fed baby is better than a starving baby. Formula can be harm reduction. Sometimes it's hard to get your milk to come in. Sometimes it's hard to get a latch. Sometimes that delayed initiation of body feeding can cause delays, or sometimes you just don't want to, and that's okay. But feeding baby, doing skin-to-skin contact, consoling baby, having your baby bond, you're literally releasing bonding hormones and helping baby regulate their temperature outside of your body, and that's really comforting. They can smell you, they can feel you. And sleeping, lots and lots of rest are some of the best things that we can do to prevent babies from going to the NICU, and greatly reducing withdrawal symptoms if they become present. Another thing that you can do is ask your provider if it's possible, if they want to initiate morphine maintenance, if they can do in-room dosing so that you and baby don't get separated in the NICU. I'm going to make a separate video a little bit about what to expect if baby does go to the NICU, because that's a larger topic. But for now, I just want to discuss why sometimes babies end up in the NICU. Babies also end up in the NICU for all kinds of reasons. So I've worked with parents that feel a lot of shame, a lot of guilt. Feelings come up around, why is my child in the NICU? Did I do something to them? Did my body like hurt them? Did something I consumed during pregnancy have a negative impact on their health? And the reality is there's so many different reasons that babies end up in the NICU. Sometimes it's a placental abnormality. Sometimes it is the baby's having a hard time holding their own oxygen and they just need a little bit of extra support. Sometimes babies are born with jaundice, which is a condition where they are a little bit malnourished and they need some extra support, medication, and nutrition to make sure that they are gaining weight and they're able to survive outside of the womb without your body helping to nourish them in such a controlled way. I am going to also talk about sometimes premature labor. So babies that are born before 24 weeks or in the second trimester oftentimes will need intensive NICU care to have a chance at survival. So sometimes babies also end up in the NICU because the cervix will open, or there is a uterine rupture, or there is sometimes the umbilical cord will be pushed through the cervix and cause a restriction of oxygen to the baby. And these are 911 emergencies that we need to get into an ER to deal with because it can really impact the survival of your baby. And hospitals with higher level NICUs are going to be best equipped to provide babies the care that you need. So this is why it's really important also to have support people around you, to be really not afraid to verbalize when you're having symptoms that are concerning you, and to seek support and to find trusted people that will help accompany you to a medical appointment. That could be a doula, that could be a friend, that could be a partner, that could be a social worker that you have a strong relationship with, or a case manager. However you want to name those support people and who you want to bring along, it's really important throughout any pregnancy journey or any reproductive journey to have those people that you can rely on so that you don't have to go through it alone. So I'm gonna close it up there and move on to the next video. I hope that this was helpful. Please let me know if you have any questions or if there's still things you want to know. We'll be moving through more about NICU care and NICU babies going into further videos. But again, this is not an exhaustive video, and I will always be listening to your feedback in order to make sure that we're creating content that best meets your needs and the community's needs. Let's keep learning together, and I'll see you in the next video. Thanks. Bye.